Welcome to the 707, a weekly half-hour program produced by KRCB, a service of NorCal Public Media. The 707 features voices and stories from your community, stories that explore the health and well-being of our children, and stories that show how we are connected to each other. I'm your host, Michelle Marques. In the November 2024 election, Sonoma County voters approved Measure I, which was known as the Sonoma County Childcare and Children's Health Initiative. The measure needed a simple majority to pass, but locals overwhelmingly supported the idea, with 63% voting in favor, approving a quarter-cent sales tax.
First Five Sonoma County is named in that initiative and now in the ordinance as the administrator of Measure I. So the county works with the state to collect that sales tax, and then they transfer the funds to us, and then we administer those funds to the community.
That's Angie Dillon-Shore, Executive Director of First Five Sonoma County, who joined me for a conversation about how the Measure I funds are being used to support children and childcare.
It had been a conversation for, I think, almost 15 years amongst kind of early childhood champions in our county. My predecessors at First Five had talked about doing some kind of ballot measure, but the conditions never really came together until like really 2022, 2023 to really move it forward and be successful. So we were thrilled when it passed.
The intention of Measure I, what is it intended to do?
It is intended to bolster our early care and education system. That's probably the biggest thing, right? That's the priority. 60% of the revenue is dedicated to childcare and early education. And so those are things like wages, childcare provider wages, childcare facilities, quality, ensuring quality, workforce development. So all of these aspects of the childcare and early care system that have been underinvested in, frankly, for many decades. That's the primary purpose. Also, it tends to benefit children's health and mental health in particular. We, as everyone knows who lives here in Sonoma County, we've endured a lot of community trauma, wildfires, the pandemic, and now a lot of impacts of federal disinvestment that really trickle down and impact young children and especially families with young children who are some of our most economically struggling families in our county. And so a chunk of the money, 40% of the revenue, is dedicated for programming and systems, services that support families, family functioning, children's health, children's mental health, screening, developmental screening, and also supporting birthing people during that perinatal period, because we know that particularly mom's mental health, her sense of hope for the future. There's a tendency towards being depressed and anxious during and after a pregnancy, and that can impact child development in a really profound way, even when it's not a full-blown clinical problem. And we don't have enough services for that here in our county, and so part of the money will support perinatal mental health services as well.
Why is First Five Sonoma County the administrator for the funds?
We are the administrator because that's really our bread and butter. So we were established in 1998 because of a state tobacco tax, right? So there's a First Five in every county in California. We're one of 58. And that's what we've been doing since 1998 is administering public dollars to support early childhood development, optimal early childhood development. That's our mission. And so we administer those public funds through grants, contracts, sponsorships, stipends. We push the vast majority of those dollars out the door, and we've done so in a very prudent, nimble, responsible way, and we've proven ourselves to be an excellent public agency for this very purpose. And so Measure I, the purposes of the funding are very aligned with our original statute, which was the Prop 10, statewide Prop 10, and very aligned with all of our strategic goals. And so it just made a lot more sense to have First Five be the administrator than to spend the extra revenue to set up a brand new organization, or to have the county administer it, which the county, for all of its awesome strengths, can't be as nimble as we can in terms of pushing money out to the community quickly, and also with the level of community engagement that First Five does.
So I imagine you already have a lot of the relationships that are necessary to know where this money would be best spent.
Absolutely. We have contractors in the area of children's health and children's mental health, perinatal mental health, early care and education. Just for example, like 4Cs, right? They are our larger childcare resource and referral agency in the county. They've been a close partner of First Five since the very beginning, and are probably our largest contractor if we looked back over, work really closely with us, and also one of our key stakeholders and advisors on how we push money out to the community. So yeah, we already have those relationships with leadership and providers at the, just the frontline level across the county. And it just made sense for us to be the one to step up and administer the dollars.
So you said that First Five, there's one in every county. But what is the relationship between First Five and the County of Sonoma?
That's a great question. So in 1998, when the voters of California voted for Prop 10, which is this tobacco tax that was the benefits would go to a First Five in every county, it was known that those funds would decline over time. Each county, their Board of Supervisors was able to make the decision about how to basically situate that public agency, their First Five, in their own county. In some counties, it was an independent agency. In some counties, it was a county department. In our county, at that time, the Board of Supervisors made the decision to embed it in our County Department of Health Services. In 2019, the Board of Supervisors made the decision, along with, a lot of recommendations and external studies that the First Five Commission did. The Board of Supervisors made the decision to separate us and redo our ordinance so that we became an independent agency. And the primary reason for that shift was fiscal sustainability. We could go for longer with a declining revenue source without running out of money and then not being able to fund any programs. And that decision on the Board of Supervisors really, really helped us so much to bridge the 5 years to get to last year when Measure I passed. We were able to sustain, keep going. We never had to lay anybody off. We did have to reduce some funding in the community, but never at a drastic level. And so the timing really worked out quite well.
When did Measure I tax collection begin, or has it begun? And when can you start investing those funds?
Great. So the Measure I collection began April 1st this year, 2025. And we just got last week that first quarter of funding. So that would be April, May, and June revenues. It's a total of about $7.5 million. And that's just from that very first quarter. It's estimated to be at about $30 million a year. A quarter-cent tax last year did bring in upwards of 30. So we're using that estimate for our planning purposes. We are in a process right now of developing a 5-year plan that will launch July 1, 2026. And so I can talk about that as well, about that planning process. But because this money has already been collected, it's already, in the county treasury, we're ready to invest it. And so we worked with our partners, with our Community Advisory Council and with the Commission to figure out what can we do this very year to invest some of those dollars, because we know the needs are immediate. They're here. They've People have been waiting for this to happen. And so we've already got contracts in place for perinatal support groups. I believe 9 different groups around the county. That'll be starting shortly. Contracts just signed last week. We'll be pushing out dollars for kind of a emergency stipend for childcare providers, our lowest earning childcare providers. We'll be expending some dollars on services for families with young children who are unhoused, so working with some organizations that provide homeless services, as well as some other things. And so we are so proud of the fact that we're able to move quickly. Again, like one of the things that makes us unique is that we are independent from the county. We're an independent organization. We have really strong administrative muscle, and we were able to get contracts together and take the plan to the Board of Supervisors. They approved it. And so this year, this fiscal year, we'll spend about $11.4 million, and all that'll go out to the community.
And what is the definition of this fiscal year?
This fiscal year is between now and June 30th of 2026.
In the next segment of the 707, First 5 Sonoma County Executive Director Angie Dillon-Shore will talk about who weighs in on how the Measure I funds are dispersed.
In the measure itself, it's required that the Board of Supervisors appoint a Community Advisory Council. That is an 11-member council that includes parents of young children, a family child care provider, a center-based child care provider, one of our resource and referral agencies is represented, and then 5 folks that are all experts in some area of healthcare, whether that be community-based care or more clinical healthcare where pediatric and maternal health, mental health is concerned.
This is KRCB.
I'm Corva Coleman from NPR News with a little something to kickstart your mornings. Sonoma First News is a weekday morning podcast with the top local stories and weather updates from across Sonoma County. From Petaluma to Bodega Bay, Sonoma First News has you covered. Subscribe now through KRCB's website, on the NorCal mobile app, or wherever you get your podcasts. Sonoma First News from Sonoma County's NPR station, KRCB-FM.
Welcome back to the 707 on KRCB. I'm your host, Michelle Marques, and I'm talking with Angie Dillon-Shore, Executive Director of First 5 Sonoma County, about Measure I, the voter-approved quarter-cent sales tax that targets child health programs and support for childcare. She says an 11-member Community Advisory Council has been appointed to help decide how to use the funds.
We've met with them now for, I think we're in our 5th month of meeting with the Community Advisory Council, and they've been reviewing really detailed proposals that were developed by our staff based on data, trend data about children's health and early care and education and wages, and as well as focus groups with parents as well as providers. So we take all that data, put together some detailed proposals, bring that to the Community Advisory Council. They weigh in, make some tweaks, move some things around based on their expertise and their lived experience, and then send us back to the drawing board if they want to. We do that, and then we bring it to the commission, the First 5 Sonoma Commission. And then once they approve the plan, we take it to the Board of Supervisors for their kind of final approval. We did, I think, 11 focus groups last fall into the winter, and that is all culminated in a really beautiful community engagement report that we're about to put on our web, that folks are interested in seeing that, and it's almost all parents, some frontline childcare providers, primarily family childcare providers. All that information absolutely both informed kind of the goals and strategies that are part of the 5-year plan, but will also inform how we contract, right? That once the plan is approved, then we have to push out, things called requests for proposals, right? Or requests for application, also known as RFPs. Put that out for organizations, community-based organizations, for the most part nonprofits, to apply for funding, and then again, we bring people together to read those proposals, score them, talk about them, and then we may even go back and negotiate with providers. Like, we really like this aspect of your proposal, but we'd really love it if you'd work with, this other organization to further enhance and leverage what you do to actually have an even better product and service in the end. So there are many, many steps to, from kind of first ideas and data about what we know is going on in the community to actually pushing that out in a contract where it becomes something where one of our nonprofits is funded to deliver the service in the community.
What about those who are providing direct care for very small children? They may be pretty small themselves. So how do they have an opportunity to also benefit from this funding if they don't have time to put together an RFP?
Love it. Yes, there was a comment made at the last commission meeting that childcare providers are not grant writers. So we were very, very aware of that. And we have a pretty strong track record at this point of trying to make our funding as accessible as possible to those very folks, those frontline providers, that their job is not to write, beautiful 30-page proposal documents for us to read and be impressed by. Like, their job is to really continue providing high-quality care to the community. So we've streamlined processes when it comes to facilities grants, mini child care grants that are kind of small in nature, but are for purchasing things like, outdoor equipment, books, tables and chairs for the child care center. We just actually did the mini grant cycle that is utilizing the Measure I funds. And I think we made 132 mini grants from that pool, which was almost everybody that applied got one. And we'll be doing that, I think, twice a year over the 5-year cycle. And then there will also be, because we know that wages just for childcare providers it's not a livable wage in Sonoma County. Very, very challenging for folks to stay in the field if that's their field of choice, if they want to spend their careers taking care of kids and educating young children. And so we will be rolling out a model which will probably have kind of multiple prongs, because you have childcare providers that work for another organization and they work in a classroom and they're an employee, and then you have childcare providers that literally work out of their own home, providing family childcare to a small group of children in their own home, and they're business owners, right? They have their own businesses. They're not nonprofit organizations. And so we are including both of those groups of providers, and we just put out a contract with an external consultant that has a deep understanding of that kind of challenging system. It's, it's not a centralized one-size-fits-all, right? It's all about what do families need, and is going to help us design a model for how we push out to a wage increase. Basically, we're calling it a wage boost. So it might look like a stipend. It might be a percentage. We're not sure what the eligibility and the criteria will be. In that process of designing that model, we want to do an even deeper dive with providers themselves so we can really understand what it is that folks need. Cash is great, and it's not always what people want, right? It could we don't want to inadvertently cause harm to someone by either putting them in a different tax bracket or making them ineligible for the benefits that their family needs. So we really want to understand, what is it that people need? Is it insurance coverage? Is it paid sick time and paid vacation? Childcare providers that have their own businesses and work out of their homes don't get paid days off, right? Is it paid substitutes, right? Like, what will help basically your quality of life, your economic security, your economic mobility, right? To stay in the field of early care and education in Sonoma County. So hope to get that launched, I would say, in the first year of the 5-year plan.
Is there any funding that will help encourage more people to enter the field?
Yes, so we're going to partner with the Santa Rosa Junior College. This year, we've already have a contract with the kind of early investments this fiscal year, partnering with them to support a program that they just rolled out last year, which is a paid apprenticeship program. So they have been supporting folks that are going into the ECE field, working on doing their coursework, right, to get their credential and get licensed, and then also paying them while they're actually doing their hours where they have to be observed. And, it's just part of a lot of careers, right? You got to do your time in the classroom. This has never been something that was paid before and really challenging to get through. So one of our contributions will be supporting the paid part of that apprenticeship. So we'll be doing an annual report that will be shared out into the community, with Measure I, because these are local dollars, local taxpayers' dollars, as opposed to, the Prop 10 tobacco tax dollars that is statewide money. We know that, we have a different level of obligation to Sonoma County voters to communicate often and transparently and really share what the impact of their, support of Measure I was and the tax dollars that they're paying into that we're expending and investing in the community. So we intend to put out an annual report.
You can learn more about First 5 Sonoma County and their role in handling Measure I funds online at first5sonomacounty.org. I'm your host and producer of this program, Michelle Marques. Podcasts are available at krcb.org/the707. Email topic and guest suggestions to the707@krcb.org. This show is a service of NorCal Public Media. Our president and CEO is Darren Lachelle.